First Commonwealth Bank. It's WCCS, AM 1160 and FM 101.1. And Dr. Andrew Billon is with us this morning from the Indiana Regional Medical Center. Good morning.
Good morning, Todd. It's a pleasure to be here.
Good to have you with us here today because we need to talk to you. What's going on at the Indiana Regional Medical Center really is a revolution in surgeries, isn't it, with the new robotic-assisted surgery?
It truly is. First, because of our hospital foundation's generosity and Indiana Regional's dedication to our community, we were able to offer a combination of technology that no other hospital between Pittsburgh and Harrisburg offers. Really pretty unbelievable when you stop to think about it. Yeah. That's the XI Da Vinci robotic platform, which is the latest version with a critically important integrated table motion.
And what it boils down to is robotic-assisted surgery in a way that probably you dreamed of this when you were a younger physician, a younger surgeon.
It's pretty astounding. There are several robotic companies out there, but the Da Vinci is really unparalleled. It's a surgical tool that allows a surgeon to vastly improve operative efficiency and outcomes safely. The national growth rate in robotic general surgery alone last year was about 270%.
Wow.
So it's a testimony of the progression of what we're able to offer from a minimally invasive surgical platform to our patients.
And I would guess that since you began doing this, your Zelda game has really improved. You're able to...
We were just talking before we started that at the fair, the company was gracious enough to bring a $2.5 million robotic surgical setup, and we had kids on the simulator and patients and families. It was just very well received, and people were very excited. It was really great to be a part of that.
Yeah.
But the benefits of minimally invasive surgery are just smaller incisions for major surgery. Historically, laparoscopy has been the mainstay, but now we can offer Da Vinci robotics, which is really, for lack of better words, laparoscopy on steroids.
Yeah. So you're going to be doing this hernia screening and seminar, and hernia surgery is obviously one of the big improvements when you're able to use this particular surgical technique. And there are others, of course, but this is coming up on Tuesday. November the 14th is coming Tuesday at 6 in the 4th floor family waiting room. Mm-hmm. And people need to know about this, and this is a good way for them to learn.
Yeah. Patients are experiencing less pain sooner. They recover faster. Their hospital stays are shorter. They're back to work sooner. And importantly, these days, especially with the attention to opioid dependency, patients require less pain medication. Just because they just do have less pain that much sooner.
Yeah, absolutely. Okay, so when we consider I remember when laparoscopic surgery came into vogue and came into widespread use, so what a great advance that was. This, as you said, characterized a couple of moments ago to me, and it was a great characterization. It's the next progression, isn't it?
It really is. Our visualization laparoscopically has always been fantastic, continues to be fantastic, but the difference is instead of a flat screen 1080p picture, we can see three-dimensionally. We can magnify the field of view 40-fold. Our operative control is better. I can control 4 arms simultaneously. By the way, there's a common misperception that the surgeon is sitting in another room just programming a robot, and the robot does the entire procedure. No, The surgeon is intimately involved with every step of the surgery. Now, the day may come 10, 20, 30 years from now where that might be different, but for now, the surgeons are involved every step of the way.
Yeah, when you're sitting here in your office in Indiana doing surgery on somebody in Mexico, that's a few years down the road. Right now, let's focus upon what happens here. But someone going in, describe for us what someone undergoing this procedure is going to feel as they are being wheeled into the room and you are there. Mm-hmm. What are they going to experience?
Well, they're going to see the operating staff. They're going to see a brand new operating room, over $100 million facility that has the latest of everything. They'll have the surgery performed, and when they do, they wake up, they have considerably smaller incisions, fewer incisions, and less pain right from the get-go. Patients who, for instance, in the past had been staying in the hospital for 3 to 4 days, that time is cut in half. And really, the patients are ready to go. I mean, patients will verbalize to you, hey, I feel great. I'm out of here. Their gastrointestinal function comes back faster. They have less nausea, less vomiting that you'd see sometimes with narcotic use, that narcotic requirements used to be for a hernia operation, for instance, an inguinal hernia operation where we might do the standard repair, gold standard repair, by the way, 7 to 10 days of narcotic use. Now, 1 day.
Wow.
Is typical.
Wow.
Typical.
That's amazing. And just in terms of the cost for the patient for those drugs is one thing, but then the fact that they are getting off of them and back to normal so quickly, it has to be just a wonderful development for them.
Yeah, we started doing surgery in August with the surgeries that we see most commonly, gallbladder surgeries, hernia surgeries, and we've been very successful. We're progressing now to colon surgery. And but again, these are surgeries that we've been doing all along for years and years laparoscopically. We've been very successful, and now we're just able to offer newer, better technology.
When you began to use the system, I'm thinking in my terms, in layman's terms, about someone who has his hands on an instrument like that is in such a small space, doing such intricate maneuvers, that it would be very easy for me to believe that, oh gosh, if I move way too quickly, I'm gonna do something that's harmful. The system is able to compensate for any sorts of movements in that way, isn't it?
Yes. The safeguards that are built in are even beyond the imagination of the surgeon. But when we say we can control 4 arms, that essentially eliminates variables for us. And when we set the robotic arm operatively, that arm is not moving at all, not 1 millimeter.
Amazing.
And so we know that the level of tension, the level of retraction is exactly as we set it. We don't even have to look at it again. We can focus directly on what we're supposed to be doing and not having to keep our peripheral vision open for something that might be going on next. Although we still do, we've been trained to keep an eye on everything.
And seeing the image in 3D, and I would assume from several different angles as well, has to also be a tremendous advantage for you as a surgeon.
It is. It's a tremendous advantage. I was just speaking with one of my medical peers today that one of the latest articles were saying that, well, there's not that big of a difference between laparoscopy and robotics. But any time a surgeon can see three-dimensionally, can magnify something 40-fold, can control 4 arms, not just 2, all else being equal, I would say it's already a better operation. It's already a better platform for our patients.
Yeah. The event coming up on Tuesday, the hernia screening and seminar, you and Dr. Billon will both be there, and you will be conducting screenings at this event.
Yes. I should add Dr. Gudetti. He will be performing those surgeries also with us. So there will be 3 general surgeons there, Dr. Billon, Gudetti, and myself. We'll talk a little bit about hernia surgery, including robotics. We'll be examining patients, and it's a very exciting time. It's an exciting time for our community, for our institution, and we're all very dedicated to the process and happy to be a part of it.
This will be happening on Tuesday in the 4th floor family waiting room. Now, space is limited to the first 40 responses, and I have no idea how many responses have been received so far, but you need to call 357-7188 to see if you can get in for this free community event happening on Tuesday, the hernia screening and seminar. And Dr. Billon is with us this morning. We're talking about robotic-assisted surgery and what they're able to do with it now. when you go through med school and the early process of being a surgeon, and then you see advances coming down the road, and probably now you're hearing about where in 5 years
Yeah, it's true.
your world is going to be.
Well,
How excited does that make you?
It's super exciting. You know, I started medical school in the early 80s. I started my residency in the mid 80s. That was 5 years long. I finished in 89, and we started doing surgery classically, and then and then laparoscopy came along, and then we had to kind of adapt that transition because it was definitely better. And so years later, robotics has come along. We can't ignore it. It's better for our patients. It's better for the workforce. It's better for everyone. So yeah, I have the unique perspective of being old enough to have seen classic surgery, and it's morphing into laparoscopy and ultimately robotics. So it is very exciting for me, a good time in my life.
And not that you're old or anything.
Wait, I'll have to hide my
people of a certain age, they get resistant to new technology. You can't afford to do that with what you do with your life.
You can't. And truthfully, change is tough. It's tough as you get older. But when you look around you and see what's happening, you either embrace it and be part of it, or you really become less relevant.
Yeah.
And it's all part of being the best you can be, offering your patients the best available, and offering institutionally the best that we can. So.
And I would guess, just my guess, that when you become proficient at what you do with this particular technology, it becomes downright fun.
It's actually we've finished over 50 surgeries. The results have been overwhelmingly successful. So yeah, there's certainly less stress. The team is fantastic. We have 2 teams that are entirely dedicated to robotic surgery. They're available 24/7 for any robotic procedure that's happening. Our Da Vinci representatives are here for every surgery. We have a Da Vinci mechanical support system in town.
Oh, wow.
Yeah, so that's a very big bonus to us. But in terms of what it's affording our community hospital, we're able to attract now, because of this latest technology, surgeons that are the best in the industry. All recently trained surgeons, whether it's in urology, gynecology, general surgery, or thoracic surgery, are robotically trained. When they see that level of institutional commitment, they know what it means. It's a $2.5 million piece of equipment that offers the latest technology, the greatest surgical capability. And now these new surgeons, whether they're elder statesmen that have been trained robotically recently, or new surgical training graduates, they know they can offer the best of what they've been trained to do, and that's what it takes.
Yeah, and they find it right here in Indiana.
I'm proud to be proud of it.
As you said, between Pittsburgh and Harrisburg, you're not finding this anywhere else but here.
It's astounding. It was only after the foundation and the hospital made a commitment to this combination of technology that it became apparent that this is what we had. So I'm very, very happy and proud to be a part of that.
Wonderful, wonderful. He's Dr. Andrew Billon with us here this morning. The hernia screening and seminar is coming up on Tuesday in the 4th floor family waiting room at IRMC, 6 p.m. to 8 p.m. And again, seating limited to the first 40 responses. So please give a call to 357-7188 at your earliest convenience and find out if they still have room for you for this event. Otherwise, of course, they can always go through the normal screening procedures, contact the office, and off they go.
Yes.
Wonderful, wonderful. All right, it is Indiana in the Morning, presented by First Commonwealth Bank. It's WCCS.